Today I'm going to be talking about intake sessions and how to do them well, but really importantly, how to stop doing them poorly. Now, let's think about the intake session and what are the goals. Most junior psychologists feel like one of the main goals of the intake session is to get as much information as possible, and they'll go into that session with a list. They want to get a history of the presenting problem. They want to get a personal history. They want to get family history, a genogram, understanding of the person's relationships, as well as a whole bunch of kind of risk things that they want to check in on. Risk for suicide, risk for drinking, risk for drugs, risk for violence, etc., etc., etc. Now, one of the problems of that model of doing an intake session is that it's fundamentally opposed to what the client needs from that session. So instead of an intake model, today I'm going to talk about an engagement model. What does the client actually need? Now, use some empathy, use some imagination, put yourself in their shoes. You've been thinking about this session for weeks, maybe months, and maybe weeks or months before that, you've had a wife, a husband, a brother, a mum or a dad, somebody who's been saying, we care about you and we want you to go and see a therapist. You're ready to go. You've got your story. You know what you want to get out of this session, and you go in there. And now the therapist sits there with a clipboard in front of them to gather information from you. Now, don't get me wrong. There's some information that's absolutely non-negotiable that you as a therapist need to get. But let's think about what does the client need to get out of that session. I'd argue that one of the most important things that the client needs to get out of the session is the decision on whether they're coming back or not for the next session. We know that between 20 and 40% of clients are voting with their feet and will never come back for the second session. So let's think about what goes into that decision and make sure that our intake model doesn't replace our engagement model. Firstly, one of the most important things that is going to go into the decision as to whether the client comes back or not is whether they think that you understand what their goals are. More important than knowing their family history and all of their background is making sure you understand why are they there and what do they want to get out of this whole thing. And secondly, communicating to them that you understand it and that you and them are on the same page together. Secondly, we should be trying to establish how the client understands their own problems, but also how they think about recovery. Some people will imagine that what they need to do in therapy is to talk about their childhood, talk about their dreams, talk about all of the things in their background that have made them the way they are. For that person, they will have very different preferences in therapy to the person who comes along and says, I just want to get some tips and tricks to get through this situation right now. Understand the client's goals, but really importantly, make sure you understand how the client wants to get to their goal. The final thing that I think is really critical to do in that engagement session is to understand if the client has any really strong preferences about the therapist or about the nature of therapy itself. Now, research is pretty clear that matching clients based on demographic characteristics doesn't lead to better outcomes. Male clients do not need male therapists. Female clients do not need female therapists. Members of the LGBTQ community, people who've got strong religious affiliations, all of these particular groups don't necessarily need a therapist who belongs to that group, with the one key exception, if the client states that they need that. When someone says, I need a Christian counselor, or I need a male therapist, or I need a therapist who identifies as being trans, then that is going to be a significant predictor of outcome. In that first session, understanding any client preferences that are going to be a barrier is far more important. Now, what I've talked about today is just a very quick taster. If you'd like to know more about it, I'd really encourage you to have a look at the work of my friend and colleague, Daryl Chow. Daryl's book came out a couple of years ago, The First Kiss, and it really changed my thinking about how we conduct intake sessions. Check out Daryl's work in the link down below.